Hi, I'm Annette from inspiredannette.com, and this is my daughter Alexia, who's 19 years old.
Hi.
We're on a walk today at the Floridale Dam. It's absolutely beautiful. You can see the water in the background there. Oh, it's pretty and nice. And on the other side, we have like farmland, and it's, really nice
Yeah.
and beautiful. And we just thought it's good for your soul to be out in nature. We thought we'd go for a walk. And we decided that we'd do a video today because of the experiences that we both have with mental health issues. And so I thought that I'd pose some questions to Alexia because she's had mental health challenges since she was 13 or 14.
Yeah.
How old?
13. Actually, it started when I was 11, and that was the first time that I ever had a challenge with mental health. And I've been dealing with it for a long time, so we can talk about it, and maybe we are going to start a video series called Life Lessons Pertaining to Mental Health. And this would be a really good learning experience or listening experience for anyone who just wants to feel comforted or wants to feel like they're not alone and wants to take some advice. Because you know that other people online just kind of say, oh, it'll get better, but they never say how. And that's really important, and today that's probably what we're going to talk about the most.
Yeah, so as a mother to a child with mental health challenges, I have a whole different experience than Alexia, obviously, because I'm on the outside looking in, and she's the one that has the turmoil and the challenges on the inside of her. And when you're a young person, so this started when she was really young, when you're youth or, adolescent, even young adult like Alexia is now, I mean, there's a lot that you don't even know about yourself. And you're trying to figure out adolescence, and then you have additional challenges on top of that. And it's kind of like, I don't even know how to talk about it. And as a mother, my big dilemma was, how do I help her to deal with the issues that she has? So,
And on the other side, as the person with the mental health issues and the child, I did not know how to reach out and ask for help. I was pushing my mom away, and that's something that we're going to talk about today, is how to reach out and how to take control for yourself and start to begin the steps forward in making your life better. And nobody ever really recovers from a mental illness, but dealing with it and making sure that you have yourself under control.
So you're saying that you don't ever really recover, but you probably do cope better, right?
Exactly.
Yeah.
Recovery is different for every single person. So some people will always live with their mental illness, and some people actually will move on and fully recover. That usually is major depressive disorder, general anxiety disorder. You can move on from those. There are some more permanent diagnoses, such as bipolar, which I have, and schizophrenia, etc., that you can't really recover from, but you will cope, and there's always hope.
And you can manage better, right?
Yeah.
Yeah. So you have you're learning strategies on how to deal with things like suicidal ideation, and when your anxiety gets really high or your depression gets really low.
Yep.
So what kind of assistance are you getting right now?
So when I was 11 to 13, I went to my family doctor. That wasn't a good idea at the time, but it was a first step. Maybe if you haven't done anything to begin your journey into mental health wellness, you can listen to this story and try to figure out where in your community the best supports for you would be. So my family doctor put me on a medication that ultimately made me feel a lot worse because I was young and he did not understand what struggles I was truly going through.
Or psychiatric medications, probably, too, right?
He also did not know how to really treat with psychiatric medications because he was a general practitioner. So this is a very emotional story, and I'm sorry if I get emotional, but I got very depressed and ended up going to the hospital shortly after I was put on Prozac, a very known medication for major depressive disorder. That was when I was 13. So, the hospital, I was in and out until I was 16.
Oh, we should let people know, the viewers know too, that she was on the child and adolescent psychiatric unit.
Yeah, I was in the inpatient psychiatric unit. So it was an actual kind of,
Inpatient program.
inpatient program, what
Yeah.
people would call a psych ward, which is a terrible stigmatism. But we're going to just, let everyone know what.
Call it what it is.
Yeah, call it what it is, really. So it was specifically for childs and adolescents. This was actually a great support throughout the years. It kept me safe when I needed to be safe, and
Yeah,
it
you
kept
went
me
back
from
there
harming
quite a few
myself.
times,
Yeah,
right?
I went back quite a few times, like I said, until I was 16. So if you have mental health issues and you don't know how to address them beginning, I would say don't go to your family practitioner. If you can seek other help in the community, such as a mental health helpline on the phone,
Like a
or
crisis line?
or a mental health clinic, then that would be probably your best bet. Because family practitioners don't really know how to deal with it. That's
Your experience,
my
right?
experience. Do you want to take
Yeah.
turns holding this?
Yeah. Okay, and so I don't know how, like, we might have viewers in the United States, and the Canadian and the American system is a little bit different, and I'm not sure how it's different. But here in Canada, what I can say is that in order to get a referral to a psychiatrist, you have to go through your family doctor. Now, another way that you could go is you can go to the emergency room, and then you're assessed by mental health worker, and then they decide whether or not you're going to see the psychiatrist that's in ER at the time. And
Yeah.
then you might get a referral to, a community-based psychiatrist that way. So there's a couple of different routes there. I don't know if in the United States if you can access psychiatrists directly, but that's how it works here in Canada, right?
So I was kind of wrong to say don't go to your GP. Go to your GP, but go for a referral. Don't go and listen to necessarily their
For
advice
treatment.
for treatment, because you need to see somebody who is specialized in treating mental health if you have a mental health disorder or feel like you do. If they know how to treat scraped knees and give vaccines, and they're not specialized and trained to deal with the issues that you're going through. And that's just the straight facts. If you don't feel comfortable with what they're telling you, especially, then don't listen. If it's a GP that has a lot of experience or previously has practiced as a psychiatrist, then go ahead and listen. It's not my place to tell you what to do. If you feel safe and comfortable listening to their advice, go ahead. But the major part is don't settle for less than you deserve. You are in control. Believe it or not, even though it might feel like it sometimes, you are actually in control of your mental health. And I know your head may wrap around you sometimes and say, no, you're not in control, or, if you're a Christian, this could be the devil. And that, you shouldn't listen to that voice, whatever you believe it is. You shouldn't listen to that voice, because you are fully in control. Don't settle for less than you deserve. Get the treatment that you actually deserve. Don't just take some Prozac and be like, oh, this is going to be all better. Unless it's actually, you feel like this is what you need and have done your research.
Don't you find, Alexia, that some people, when they take the first step towards getting some kind of treatment for mental health issues, that the first method of treatment that they receive, if it's through family doctor, let's say, they think that, excuse me, they think that that's the best that they can do. But, what you're saying basically is, not to settle, right?
Yeah, don't
That
settle.
if you don't feel good on your medication, you don't have to think, okay, this is the end of the road for me. There are other programs, and there's other coping strategies that you can learn. Why don't you talk about that program that you're in, the mood disorders program? That's a really great one.
So, as I was going to say, I've accessed the hospital, the CAPE program, Child and Adolescent Inpatient Psychiatry, for many years, until I was 16. That program stopped when you were 18, so I was getting to feel better and starting to take control of my own mental health, because once I was in there for a few years, I realized no one is going to help me. except for myself. No one other, the doctors can't make this better unless I try for myself. So that was a huge lesson. That was the first step to actually feeling better, was realizing that no one except for you has the control. And I keep repeating this because it's the most important message that we're trying to relay today. That you can make a difference, and you will make a difference if you take the initiative to. And this is just some tips and experiences in the Canadian mental health system that we have experienced as a mother and daughter. So
Yeah.
don't necessarily take everything we say to complete. This is just our experience, but the main message is that you are in control.
Yeah, and the thing is you can look for supports for yourself. Alexia is just starting university in next week, and so this is her first year university at McMaster in Hamilton. Yeah. So she's changed geographically. She's moved. She moved from Waterloo to Hamilton. And in Hamilton, the mental health care system is just a lot more advanced there. And they have a lot more supports for patients. Mm-hmm. And when Alexia moved to Hamilton, she was able to access this outpatient program called the Mood Disorders Program, right? Mm-hmm. How did you find out about that program?
So, I had to take the initiative myself. I went to a family physician that not even a family physician. It was actually a walk-in clinic that my dad and stepmom, not this mom, have used in the past. They told me about her because I had menstrual problems, and I was just, going through girl problems, whatever. And I went to her, but also at the same time I said, I need a referral. I have bipolar disorder, and I need to be referred to a program where I can access a team. I was very specific about what I wanted because I didn't just want a psychiatrist. I had seen psychiatrists in Kitchener-Waterloo previous when I was in the hospital, and I didn't just want one person that was kind of cold and clinical about the approach. I wanted a team. So that's exactly what I set out to do, and I got it. And I am so thankful that the system in Hamilton is exactly the way it is, because they have a mental health hospital there that allowed me to access this program. It's an outpatient program, which means you don't have to stay in hospital, and you get to see regularly the doctor and the nurse. For me, that's what it means. And
it's disorder specific, right?
Yeah, it's for mood disorders.
It's not for depression and this and that. Mm-hmm. Yours is for mood disorders only.
Exactly. It honestly has changed my life in the way that I know I will be with them until I feel better on medication, and about life in general.
Are you learning some cognitive behavioral therapies too, like methods to help treat yourself, right?
This is another thing that is really important to learn, is it's not just about the medication, and it's not just about the doctor and the nurse and blah 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 and staying in hospital and all this cold clinical approach. You do have to take the initiative to go into therapy. No matter what issues you're dealing with, everybody could use a therapist. That's seriously, don't you agree with me?
True.
No matter what you're going through in life, you could use someone to talk to about it that can't tell anyone else and is just there for you. Everybody has issues that they need to work through, because life is a crazy ride, especially with how convoluted and complicated it's become with technology and how far that we've come from just the human nature. I think that now everyone could use a therapist, especially if you feel depressed, if you feel anxious, and if you're having any typical symptoms of mental health disorder. It doesn't just stop with the medication. You have to work on yourself with yourself. And this, again, takes initiative and takes a lot of patience and time from you. And
you got to be dedicated to your own treatment,
to yourself,
right?
Exactly.
Yeah. Mm-hmm.
So, yet again, this is the main message for anyone who's just tuning in now, is for mental health, you have to be in control of your own mind, and you have that control. You have the ability, and you can take the initiative. no matter where you are. I believe no matter how crappy the system is, because honestly, when I was in Waterloo, I felt that that the system wasn't serving my needs, but I still held on because I knew that there was hope, and I knew that I was in control.
Yeah, so I think, you know, our message today, we're probably going to continue our walk now,
Yeah.
is that don't give up.
Mm-hmm.
Because, you know, sometimes when you have mental health challenges, your mind can mess with you first to start off
And
with.
say you're not in control. You're not.
Yeah.
You have
I'm
no
always going to be
purpose.
this way.
There's no hope.
There's no hope for me. And I don't want to take medications because this, that, and the other. And we're going to do a whole other video show on medications because, man, do we have experience with that. Alexia's tried a lot of different ones. And I can tell you because I was very involved in her treatment, I always had meetings with child psychiatrists and things and social workers and whatnot. So, and I did my own research as well. So I think we'll do a show on that, hey?
Yeah, we'll do a few shows on medications, on
Oh, we could talk a lot about
therapy
medication.
specifically, but today is the first steps. The first step is
that
telling yourself that you are in control.
And you can empower yourself by knowing that and being aware of it. And I can tell you as somebody, as an outsider that had to watch and witness Alexia go through all these past few years, has been sometimes very horrible, that there's hope and you can get help and, you know, just don't give up. Don't give up on yourself.
Don't give up on
Don't
yourself.
give up on the system. And we're going to talk about also how you can find community supports for your particular disorder. So tune in the next time. Bye for now and bye from the trail.
Don't give up. You are worth it and you are going to make it through this.
Bye.